I'm so excited to present these four amazing people to you today. I'm going to introduce them one by one so you have fresh in your mind who they are when they begin to speak. We are going to start with Shanelle Matthews. Shanelle Matthews is here representing both Black Women's Birthing Justice Collective and ally organization of ours, ACRJ, Asian Communities for Reproductive Justice, who is soon going to be known as Forward Together. Okay, so they're going to be undergoing a name change. You heard it here first. In her capacity as the communications manager at Asian Communities for Reproductive Justice, Shanelle Matthews creates visibility and brings the unique needs of families on the margin to the center. In addition to that work, Shanelle does research in the area of Black women's maternal health with the Black Women's Birthing Justice Collective. She has a knack for words, and though she's far less witty than she cared to admit, says her, you can usually find her buried in a good book or rallying up protesters for a cause. She has a twin sister and two young nephews who she spoils rotten, and I believe that she was inspired by her sister's birthing experience and the work that she does. So let's all welcome Shanelle Matthews.
Thank you. Carla's such a fierce, inspirational person. I feel like speaking after her, I'm like, I think it's fitting that we're in the spiritual place because she was really like going to church on us earlier. But thank you all for being here today. Thank you for having us. We have a very close relationship with Women's Generation at ACRJ, and we're grateful for all the work that you all do. I'm especially grateful to be sitting on this panel with these fierce, amazing sisters and comrades, and they can speak to birth work and all the elements as practitioners and people who do healing work. And I will, and I will just, no? Okay, yes, hi, okay. I will just give some context to the history of, the politicization of birth work and reproductive justice as it fits into a framework. So, as she said, I'm the communications manager for ACRJ, and we've been doing this work for several years now, and we will now be forward together starting April 1st. Okay, so what is reproductive justice? Reproductive justice is essentially the notion that it will exist when every person has the social, political, and economical resources to make the best decisions for their gender, their sexuality, their families, for themselves and their communities. And so birth justice lie in this framework and essentially says that it will exist when women and trans folk have the resources to make healthy decisions for their babies and themselves. And so essentially, reproductive justice, unlike reproductive health and reproductive rights, intersects with race and class and other social constructs in an effort to really encompass women of color and people on the margins, their experiences in this country. The politicization of reproductive justice has both helped and hurt our communities, and we are seeing this more and more now in today's as Carla was mentioning, in today's philosophy on people's experiences with reproductive oppression. And so she talked a little bit about the war on women's reproductive health right now. And so we're seeing a lot of politicians and policymakers who don't have our best interests at heart. They don't look like us, and they haven't shared our experiences. And so they're not able to have the empathy that we need them to have. So there's this duality of people who know about this self-healing work and work that we're doing, and they're the people who don't. And it's not our job to shame them about what they may know or may not know, but it's our job to educate and empower them through the work that we're doing. And so just last year alone in 2011, we saw 916 initiatives that were aimed at communities on the margin to stop our access to reproductive health care. And this is not even about, we're talking about access to birth control, access to abortion, access to reproductive health care services. There are significantly more initiatives to stop access to midwifery and having alternative birthing practices. We saw 15 laws passed last year that mitigate women's access to reproductive health care, including a law in South Dakota that forces women to wait 72 hours to have an abortion and to have to sit through a crisis at a crisis pregnancy center with a counselor to talk so that they can talk them out of there and shame them about their choices. So we're seeing a couple of things, we're seeing several things happen. One, we're seeing no access to comprehensive sexual education in our schools, and so we're having our youth and our young people come home with abstinence-only education or no education about sex and sexuality at all. And then once they do get to the age of having sex, which I mean in the States we're seeing that we know that the average age that somebody in the US has sex is 17, but we're seeing people have sex earlier than that. They have no access to birth control because they shame them about that, and then you can't get birth control without parental consent if you're under 18, and that makes it uncomfortable for you to find access to birth control. And then there's no birth control, and then there's no they're trying to mitigate access to abortion. So once you do get pregnant, your options are limited. They're shaming you about that choice. Once you do have the child, there's no access to public funding. So there's this really nasty circle of oppression that's happening in our communities, and these policymakers are not making it easy for us to make the best choices for ourselves and for our families. So basically what we're seeing also is, so in Arizona, I don't know if you all have heard, but they're trying to pass a law now that is requiring women to tell their employers why they want to use birth control, and if the employer says, well, I don't think that you should be using birth control simply for contraception, if it's not being used to help mitigate like polycystic ovarian disease or for some other health reason, that they have the right to say no, and they also have the right to fire you. We're also seeing in Virginia and Utah this policy around transvaginal ultrasounds, where women are required to have a foreign object stuck up their vagina so that they can see the fetus before they decide to have an abortion, which is essentially sexual assault and rape. So we're dealing with a lot of attacks on our reproductive freedom right now, and we have to start, as communities of color and marginalized communities, start really politicizing our efforts to make real the options that we should have in our communities in terms of whether to have children, to not have children, and to birth and parent those children with dignity. And we have to let policymakers know that we are going to stand our ground, and we're going to stand up for people who look like us and for the experiences that we've shared, and recognize that there are places like this that exist for us to really rally behind our cause. And so, it's not always fun to do the policy work behind this, but it's a very real thing, because there are people out there who are trying to not let people know that places like this exist, that places like Reclaim exist, that people like Kadala are doing the work for MG, like they are trying to take that away from us. And so we have to kind of be both shaking hands inside, making deals in policy, and outside organizing in grassroots organizations. So should you all have any questions about the work that policymakers are on the progressive policymakers are doing to try to help women and people to sustain themselves through reproductive justice, please feel free to come talk to me later. Thank you.